Hi guys, welcome to Arogya physiotips. आपका आरोग्य physiotips में बहुत बहुत स्वागत है. Today I bring a topic about the sacralization. Many people know about the sacralization topic, but they only know the sketchy information. They might be think it's a low back pain. They might be think it's a sciatica, but no. Many of the patients know about very doubts are there in their minds. Don't worry. In this video, we'll clear all doubt about sacralization. So now let's understand what is sacralization. So basically, sacralization is a condition where the base of the spine get attached to the top of the pelvic. It means bottom of the vertebra, L5 vertebra, get attached to the top of the pelvic, which is known as sacrum. So between the L5 vertebra and the sacrum get fused together. When it get fused together, the movement got restricted. Between the L5 and the sacrum, there is an articulation which is known as lumbosacral articulation. That articulation occurs between the L5 as well as the S1. So, bottom of the vertebra, which is known as L5, in between that and top of the pelvic, there is a disc which is very flexible material, which is made up of very flexible material, which allow the spine to move any direction. Okay, so basically the sacralization is a condition where the lumbar spine partially or completely gets fused to the top of the pelvic. So let's move on to causes of the sacralization. It's normally as a congenital. Many of the parents just neglect that thing because many of the kids, they say they have low back pain on your backs, but they say there is nothing because of you fall down, that's why. No, you have to notice at that time because that's the time when you can know about it with the help of MRI and CT scan. So it might be because of the congenital and second idiopathic. And as well as probably might be chances of there is an unknown factor also can be determined for the sacralization. And the main causes are occur in the embryonic development. Like when the vertebra get ossified in the 8 weeks, at that time might be chances of sacralization too. So the question is how you will understand where it is, how we can understand this is sacralization when we go to hospital and take them away. There is a symptoms where you can determine it is a sacralization also. So main symptoms is low back pain. Second, there is an arthritis around the fusing area, like fused area is L5 and S1. And the third is degenerative disc, as well as the low back pain might be there, leg pain, gluteal pain. So apart from this, there is a symptoms of bursitis, limited range of motion, difficulty in movement and scoliosis too. Keep in mind the symptoms. According to that, you can determine how the sacralization gets started. So let's move on to examination. So there is an examination which we can test by yourself in home, that is known as Gallen's test. For that, you can lie down on a splint as well as on a mat. Fold your one knee towards your chest. Take your both hand, hold the knee towards you, and you have to give a nice stretch. While doing this stretch, the sacralization patient can't able to do this thing because they got pain. So in examination, why the patient can't do this exam? Because of sacralization, like in L5 get fused to the S1. One side hip got hike and one side hip got down. It's dropped. So because of that, they're unable to stretch their knee towards the chest. So let's move on to treatment, and the specific treatment of sacralization is muscle strengthening as well as the core strengthening exercise. Before moving to the exercise, please like, share and subscribe, and please comment below if any doubt about the sacralization or any topic you have, please comment below. Before starting the exercise, please keep in mind every exercise is you have to do 5-second hold and 10 repetition. So the exercise we are going to start is isometric abdominal exercise. For that, you have to lie down on a mat, bend your both knee towards you like this. Place your both hands on your tummy, press your back onto the floor, hold it for the 5 seconds, press down, take a deep breath and relax. Again, press down, hold it and relax. Now the next exercise is trunk rotation. For that, same, you have to lie down and you have to bend your both knees like this. You have to fold your both knees and rotate your both knees in one direction and head on the opposite direction. Hold it, then again change, then the opposite direction you have to do both bilaterally, then relax. Next exercise is knee to chest exercise. For that, you have to lie down like this on a mat. Fold your both knees. With the help of your both hands, hold it and towards your chest. Give a nice stretch to your buttocks and the abdominal muscles. Hold it for 5 seconds. Then relax. Next exercise is bridging. For that, you have to lie down and bend your both knees towards you. Place your both hands downward, relaxed. Rise your hip up. Don't arch your back. It should be straight to your body. Relax. Hold it for 5 seconds and get back to the position. Next exercise is, for that you have to lie down and fold your both knees. Place your both hands behind your head. Hold your head properly. Chin tuck in and lift your head up. Hold it for 5 seconds. Then relax. The next exercise is, for that you have to bend one leg, and that is known as straight stretch leg. For that you have to bend opposite side leg and straight the opposite side leg like this. Pull your toe towards you so that as much as you can straight your leg and relax. As same as another direction also you have to do. Pull towards you the leg and the toe as much as you can and relax. The next exercise in lying down position is straight leg raise. For that you have to bend your opposite side leg and lift your leg up. Remember, it should be in the knee level. And hold it for 5 seconds, then down. It might be a little difficult for you, the patient who are suffering from sacralization, but try it as much as you can. This much is enough. Gradually you can increase to the knee level and then get back to the position. So the next exercise is prone position, that is known as prone leg raise. In that you have to lie down prone on your tummy. Place your both hands under your chin. Lift your leg up. Hold it for a second. Then down. Same as opposite direction, you have to lift your leg up as much as you can. Hold it for a few seconds. Then relax. Next exercise is trunk extension exercise. For that, you have to lie down prone on your tummy. Place your both hands and take your forearm support like this. Press your back as well as the tummy towards the downward towards the floor. Press down and bring your back up. Neck as much as you can, you have to lift up. Extend your neck. Hold it for a second. Take your forearm support. Then relax. Again you have to look back, like you have to extend your neck up. If you feel in type of giddiness, hold down, back together, then relax. So in this exercise, the next is hand and knee exercise. For that, you have to in quadruped position. Like you have to maintain the forearm as well as your hand, your knee in a line. Hold it for a second, then relax. Then again hold it for a second. Maintain it. Look up, straight, neutral, then relax. Now the next exercise is cat and camel exercise. For that, you should be in the quadruped position and push your back downward, neck up, hold it, then push your hip up like a hinge. Look down, vice versa you have to do. Hold it for a second. Again you have to look up, then down and relax. The next exercise is quadruped arm and leg raise. For that you are in the quadruped position. Maintain the position. Lift your one hand up as well as alternately lift your one leg up. Hold it for a second. It might be difficult for the sacralization person. Try it once as much as you can. Hold it, then relax. As much as bilaterally you have to do in both sides. Hold it, then relax. Next exercise is neck isometric exercise. For that you have to place one hand and you have to press your cheeks opposite towards the hand. Hold it, then relax. Like this in the same direction. Hold it. You have to give opposite thrust with the hand as well. Then relax. As well as you have to take your hand, press it on your forehead. Take your forehead down, and you have to look it down, but your hand has to resist it. You have to give the opposite thrust. Look down, then relax. Same, you have to place your back side, occiput position, occiput leg area. You have to place your one hand on the occiput. Press it back. Try to extend your neck, then relax. Last but not the least, the conclusion which is remaining. If there is any pain while doing this all exercise which you can't tolerate, stop there, consult your physiotherapy doctor, and you will get to know about it. Before that, please like, share and subscribe. Don't forget to subscribe it, and please comment below your doubts. Witness your fitness with us.